Pancreatitis is an inflammation of the pancreas. It's a small organ that's tucked in the upper abdomen, behind the stomach and in front of the spine. The pancreas is responsible for converting food into fuel, aiding in digestion by producing essential enzymes to break down fats and carbohydrates, and creating two vital hormones, insulin and glucagon. There's two main types of pancreatitis, acute and chronic. Acute pancreatitis symptoms come on suddenly and they can last for a few days. The enzymes that are normally released remain in the pancreas, causing it to become inflamed and swollen. This slow digestion causes pain, and it's associated with some severe complications that can become life-threatening. Chronic pancreatitis is incurable. The severity and the frequency of the chronic pancreatitis vary from person to person. Worsening symptoms are often linked to eating a large, high-fat meal or to drinking alcohol. As the disease continues to create scar tissue and damage the pancreas, the risk for certain conditions like diabetes and pancreatic cancer increase. In addition, the body can start to have a difficult time processing and absorbing nutrients, causing vitamin deficiencies. More rare forms of the disease are childhood pancreatitis and autoimmune pancreatitis. Childhood pancreatitis is considered fairly rare. It's most often found in children with cystic fibrosis or after a physical trauma. In some cases, the anatomy of the ducts in the liver and the pancreas can cause the disease in children. Anti-seizure medication, certain antibiotics and chemotherapy can also cause childhood pancreatitis. However, in nearly 1/3 of the cases, a cause will not be identified. Sharing many of the same symptoms as chronic and acute pancreatitis, in autoimmune pancreatitis, the inflammation is caused by the body's immune system attacking the pancreas directly. This condition is broken down into two types. Type 1 that can affect multiple organs, and Type 2 that affects only the pancreas. Autoimmune pancreatitis is rare and a newly discovered disease, and it can be misdiagnosed as pancreatic cancer. Because of the location of the pancreas, pancreatic cancer is often not diagnosed until late stages, when it begins to spread to other organs. If you've been diagnosed with any form of pancreatitis and experience any symptoms below, you should consult a doctor immediately about your concerns. Chronic pancreatitis is considered a risk factor for this cancer. If you have newly diagnosed diabetes, unintended weight loss and diabetes which co-occur, jaundice, pain in the upper abdomen, loss of appetite, depression, blood clots and fatigue. Pancreatitis symptoms vary from person to person and whether it's acute or chronic. In acute pancreatitis, the symptoms can be swollen and a tender abdomen, upper abdominal pain, nausea and or vomiting, a rapid pulse, a pain that worsens after a high-fat meal. The pain might be worse when lying flat on your back. Fever, difficulty breathing, weakness and shock. In chronic pancreatitis, the symptoms can be nausea and or vomiting, weight loss, diarrhea, digestive upset, oily or fatty, foul-smelling stools that float, clay-colored or pale stools, deep abdominal pain and tenderness that radiates to the back, and glucose intolerance. Pancreatitis occurs when digestive enzymes become activated while still in the pancreas, and this irritates the cells, causing inflammation and scarring. There's a number of recognized causes for the pancreatitis, including alcohol use and abuse. The long-term or single binge drinking can inflame the pancreas. Gallstones, surgery of the abdomen, heart or lungs, where the blood supply to the pancreas is temporarily cut off. Certain medications like anti-inflammatory drugs, antibiotics, and corticosteroids. Cigarette smoking, cystic fibrosis, a family history of pancreatitis, high levels of calcium in the blood, high triglyceride levels in the blood, Infections like the mumps, hepatitis, rubella, Epstein-Barr and cytomegalovirus, blunt force trauma to the abdomen, pancreatic cancer, and deficiency in nutrients like A, C, E, selenium, and carotenoids. The following conditions indicate a higher risk for developing pancreatitis symptoms: biliary tract disease, binge alcohol use, chronic alcohol abuse, recent surgery, a family history of high triglycerides, being 35 to 64 years of age, smoking, and being African American. A severe pancreatitis attack can be life-threatening. You should seek emergency medical attention as quickly as possible. Chronic pancreatitis symptoms often can be managed through diet and lifestyle changes. Also, if you're at risk for pancreatitis, make some changes that can help to prevent the development of the pancreatitis. Improve your diet. Try alternative therapies for pain. Address nutrient deficiencies. Supplement with vitamin A, C, D, E, and K. Boost omega-3 fatty acids. Add a probiotic supplement to your diet. Drink green tea. Add a rhodiola supplement. Add a reishi mushroom supplement. Try grapeseed extract, and include foods that are high in glutamine. Diet plays a huge role in the development of pancreatitis, as well as the severity of symptoms and recovery. Eliminate all suspected food allergens, including dairy, soy, wheat, corn, food preservatives, and chemical food additives. Eliminate all stimulants, including caffeine, alcohol, and tobacco. Dramatically reduce or eliminate all trans fatty acids in the diet. Focus on small, low-fat meals that emphasize fresh fruit, vegetables, lean proteins, and whole grains. Avoid any food that causes sensitivities or allergies. Add healthy oils like olive oil and coconut oil. Enjoy lean meat, including grass-fed beef, organic poultry, and cold water fish. Have foods that are high in iron, like spirulina, organic grass-fed beef, lentils, and even dark chocolate. Add more antioxidant-rich foods like cherries, blueberries, tomatoes, and bell peppers. Pain, often severe, is common for both types of pancreatitis. The Mayo Clinic recommends the following alternative therapies to help to ease pain and discomfort. Meditation. In addition to easing pain, meditation fights depression and anxiety. It lowers cortisol stress hormone levels, improves mental performance, and aids in recovery from chronic illness. The symptoms of pancreatitis cause discomfort, pain, and anxiety. Incorporating effective relaxation techniques like breathing exercises can help with the symptoms. Acupuncture has been used for thousands of years for a wide array of physical and mental ailments. It's safe and effective at reducing chronic pain. In addition to pain, a recent study focusing on patients with chronic pancreatitis found biweekly yoga for 12 weeks significantly improves stress, mood, appetite, overall feelings of well-being, and alcohol dependence. According to research, there's a causal link between certain nutrient deficiencies and the development of pancreatitis. A simple blood test can help determine if you're deficient in vitamin A, C, E, as well as selenium and carotenoids. In a review of clinical trials published in the journal Advances in Nutrition, the researchers found the bioactive vitamins A, C, D, E, and K all show promise for pancreatic cancer intervention. Vitamin A aids in pancreatic cancer prevention, and it's an essential nutrient for strong bones and immune function. You can incorporate plenty of vitamin A-rich food like beef liver, carrots, and sweet potato into your diet. Vitamin C slows tumor growth. You can take 1 to 6 grams per day, but never take a vitamin C supplement and a B12 supplement together, as they affect the absorption of each other. If diarrhea occurs, then reduce the dose of the vitamin C. You can also include vitamin C-rich foods that you tolerate, like red peppers, black currants, guava, and even broccoli. Vitamin D shows anti-proliferative effects and repression of cancer cells in the pancreas. And more importantly, a study has found it reduces inflammation and fibrosis in pancreatitis. With pancreatitis, try to get 15 to 30 minutes each day of sunshine without sunscreen to increase the vitamin D naturally. In addition, focus on cold water fish like halibut, mackerel, and salmon. Vitamin E has been shown to inhibit tumor cell growth and helps to protect against heart disease. A high-quality vitamin E, or even better, foods like sunflower seeds, almonds, and hazelnuts are recommended. Vitamin K has been shown to inhibit pancreatic tumor cells, which is impressive for those with chronic pancreatitis. It's well tolerated, so aim for 300 micrograms of vitamin K2 through organic foods like dandelion greens, mustard greens, or Swiss chard. Adding 1 to 2 tablespoons each day of a high-quality omega-3 fatty acid has been shown to reduce inflammation and to improve immunity. In a meta-analysis published in the journal Nutrients, supplementation reduced the risk of mortality, infectious complications, and reduced the length of hospital stay for pancreatic patients. Authors encourage large-scale, multi-center, randomized clinical trials. Adding a high-quality probiotic supplement for those with acute pancreatitis was shown to reduce intestinal inflammation, organ dysfunction, and pancreatitis symptoms. You should take at least 50 billion CFUs of probiotics per day, while the symptoms persist for the best results. The introduction of the probiotics also helps to rebuild a healthy gut function during and after a round of antibiotics. According to a recent study, the regular consumption of green tea inhibits the development and the progression of pancreatic cancer. Researchers note that for women, this results in a 32% reduction in the pancreatic cancer risk. They also note that a lower temperature of the tea is linked to its benefits. The powerful herb rhodiola is an adaptogen, and it's been shown to enhance energy and to boost brain power. It's also been shown to improve the kidneys and the pancreas function in rats. Take 350 milligrams to 500 milligrams of the rhodiola twice per day for the immune support and to help with the symptoms of pancreatitis. Reishi mushroom has been used in holistic medicine practices for a long time. A recent study on chronic pancreatitis found the reishi mushroom increased the abundance of beneficial bacteria, and the researchers noted the study shows potential for using this as a possible therapy for chronic pancreatitis. Take 150 to 300 milligrams twice per day to help to relieve the inflammation while boosting the immune system's response. There's over 30 studies on grapeseed extract and pancreatitis. Many of these studies cite its protective nature, particularly against cancer cells. Also noted is its anti-inflammatory effect and its ability to fight against oxidative stress. Take 100 to 300 milligrams per day. According to a study published in the journal Pancreatology, glutamine is associated with a significant reduction in the length of hospital stay and a decrease in the complications for patients with acute pancreatitis. Add 3 servings of food rich in L-glutamine, like bone broth, grass-fed beef, or cottage cheese, aiming to get a total of 8 to 12 grams of glutamine per day. Ghrelin, leptin, and melatonin. These 3 hormones are noted in the research to significantly reduce the severity of pancreatitis symptoms and protect the pancreas tissue from inflammatory damage. You can learn how to improve your levels of ghrelin and leptin. You can restrict calories, get plenty of sleep, and manage stress. Avoid processed foods and eat plenty of protein to optimize your levels. To book a consultation or to learn about herbs, supplements, and natural treatments, check out my website.